Hey everyone, Dr. Rodman here with Sports Chiropractic, and we always get the question, what is the adjustment? So today we're going to talk about the things that we know are researched and proven and continuously shown. And we understand that people are scared or hesitant for a chiropractic adjustment. They are not sure what it is. They hear a crack, a loud noise, they've seen a ninja movie and they think someone's going to hurt their neck or hurt them very bad, and there's always a risk associated with anything, but the chiropractic adjustment, when done appropriately, is very, very safe. So today we're going to talk about what it is. And also remember, chiropractors have a lot of years of hands-on training. The same amount of hours that medical students do, we do in school with adjustments. So we practice hundreds of thousands of times to really perfect the craft. So the first thing, what is it? What does it do? Number one, increases range of motion. So what does that mean? Okay, so for someone who's not sure exactly that language, it makes you feel looser. So if you come in and you feel a little stiff, you're immediately gonna feel more mobile, more range of motion, or loose. And what's happening there is basically if we look at the vertebrae, when we look at the joints here, which is where the two bones meet, 1, 2, where they interrelate or actually are adjacent to each other, where they meet, sometimes this area gets stuck and it doesn't have a good glide when it should have a nice range of motion there, a nice spongy feel to it. It doesn't bounce or glide very well. So what we do is we isolate and we find that specific joint, we put a gentle quick thrust into it, and we get that area moving better, and instantly people will feel an improvement in their range of motion, or they feel looser, or sometimes we'll hear someone say they feel more comfortable in their own body. So that's number one. We find these areas of restriction and we mobilize them. People that try to adjust themselves, they say, why can't I do it myself? Well, what happens is maybe you'll get that one area that is stuck to move better, but you're also going to probably be adjusting or mobilizing 10 other areas that are already moving very well, and you're going to create something called hypermobility syndrome, which can create a cascade of problems down the road. So you really don't want to self-adjust. So that's number one. Number two is that it decreases or inhibits nociception, or what's called, or what we know better as pain. So what happens is when we look back at the joint level here, in between this joint right here is little teeth-like fibers called Sharpie's fibers, which are rich in nociceptive nerves. So when they get compressed and jammed from maybe the muscles around there being tight or these areas being pulled out of their specific alignment, it gets irritated. And what also can happen is that it can send that irritation, it can cause some local inflammation and cause irritation to that nerve root here as well, which can cause pain or numbness or weakness wherever this nerve may travel. So if somebody has a joint that's misplaced in the neck, it could cause headaches because it could irritate that nerve that goes to the back of the head. We see that every day here. Could cause pain into the shoulder or even down into the arm. If it's in the mid-back, in the thoracic spine, it could cause a really sharp pain, like someone stabbing you with a knife in between your shoulder blades, or pain wrapping in front of the rib cage. If you have that misalignment in your lower back, it could cause sciatic or pain down your leg, or pain into that glute area. So when this joint gets stuck, those fibers in here, called Sharpie's fibers, get irritated and aggravated and loaded and cause that pain signal to go to our brain, and also can irritate that nerve root around the area. So by adjusting or putting that into a better position, getting that joint to move again, breaking up maybe some adhesions or scar tissue within that joint, we actually decrease pain. So instantly, it's almost like a magic trick. Someone comes with neck pain and we do a very specific adjustment to that one joint that's stuck or not moving, and they're like, how'd you do that? Instantly it feels looser, instantly less pain. So those are the things that we know for sure the chiropractic adjustment can do. We also have seen some interesting things, because if that nerve root is irritated, wherever that nerve may go, you may get some amazing things. There's been people, the first chiropractic adjustment was known to restore someone's hearing. We've helped with ear infections, obviously, like we said, headaches, and many other things. So there are some things that are hard to measure or quantify, but great miracles do happen with adjustments besides those two things that we talked about today. So if you were on the fence about chiropractic and you weren't sure, what it does, I hope that information helps you. Also remember, if you are fearful of an adjustment, you can ask us if you're deciding to come in here, or ask your chiropractor wherever you're located to maybe do a different technique. We have things that are very gentle here to adjust the area without having to, maybe turn the head and get that popping noise. which people sometimes are fearful of, which is actually just a gas release in the joint. It's nothing cracking or breaking, but it's actually a release of gas within the joint, and usually increases that range of motion, makes you feel better as well. But there are other techniques, muscle therapies that we provide here, which can get great results without having to adjust that area. So, besides the spine, remember, we can adjust feet, we can adjust hands, we can adjust shoulders. A lot of things lose their position and need to be realigned, where muscle work is going to be great for it. It may not restore the centration or the alignment of that joint. So chiropractic can work for other things besides spine. I hope that helps you to understand a little bit more about what the adjustment does today. Dr. Rodman, have a great day.